Hey everybody, it's Dr. Mary Gardner with Lap of Love Veterinary Hospice, here today with a very special guest, Dr. Lisa Radosta, a world-renowned, I'm going to say it, behavioralist. But I want to just let everybody know, I come here not just as a veterinarian or as the, a host, but also as a pet owner and caregiver that is dealing with cognitive dysfunction today with my own dog. So I am with you guys in the struggles, and I brought as an example all of the things that I am using on her.
Yeah. Takes a pharmacy.
This is not her. She's also got Cushing's. She also has cancer. She also has mobility issues. So that is just to deal with her. And so I like to tell everybody that because, it's nice to know that you're not in it alone when you're dealing with this. Mm-hmm. And I'm also sleeping out in the living room, sleeping on the floor with her, petting her when she wakes up in the middle of the night for hours until she goes back to bed. I'm hoping in the next 30 minutes, she's not going to start barking. So I am with everybody. And I am really excited to have you on today, Dr. Lisa, because we've become friends over the years as both speakers, but I've admired you for what you do as a boarded behavioralist. Also, author of an awesome book. Let me make sure I get it in there from Fearful to Free. I can't talk today. Feel free. But so can you just start off, what is a veterinary behaviorist?
Yeah, so a veterinary behaviorist, you're going to look for board certified, because that means that we've gone through a residency program, right? 3-year program, usually sometimes 5 years. And then we've taken the board exam and published and done all the things you have to do to be board certified. It's the same thing really as a psychiatrist. So we're going to tie together the entire body, the whole pet. So I just saw a pet the other day, and he is just there. I know I always say this on Facebook, they're my love, but I love him. So he's 12 and a half, and he didn't come just with a sign of cognitive dysfunction. He came with 10 problems, and he has a great referring veterinarian who's already working him up. But I have to be able to go, how does increased ALT, which is a liver enzyme, cause a change in urination, which causes him to urinate overnight, which causes him to wake his mom up? So that's where you're pulling everything together. That's the difference really between a veterinary behaviorist and maybe a applied animal behaviorist, is that we have to consider the physiology of the body too.
That is so true. And, we think about pain. We think about, my girl Sam, she also has a UTI. So that's, keeping her a little bit agitated as well. So it is a very holistic view that you do. And I have used you as my veterinarian for my other dog that needs to read this book. But today we're going to focus on cognitive dysfunction in dogs. I know there's a couple people that have written to us what about cats, which can be a whole other topic. And I had a kitty with this too. So it's just a different sound. Wow, at 2 o'clock. Mm-hmm.
Yeah.
But this cognitive dysfunction, I think I did not appreciate it as much as a general practitioner until I started to do end-of-life care and go to the homes and see what people are saying, hey, staring at the wall. And I would say, well, that's, cognitive dysfunction, almost like dementia. And they're like, they can get this. And so I just don't think, sadly, over 50% of dogs and cats are not seen by their regular veterinarian the year before they die. So I know that breaks my heart.
That's a heartbreaking statistic, because that's, end of life and beginning of life are the two times that you need your vet most. Mm-hmm. And at end of life, you've got to hunt it down. Yeah. Beginning of life, you've got this little spongy, cute puppy. But end of life, you have to start to hunt down and tease out what this blood work value means and what this could be and what this non-specific sign is. That's the time you need to go, is when your pet's getting older.
This is my soapbox is that final year to 2 years. And that's where so much decline happens. But we can do so much and help them, I think, the most. So that's when I've been doing, in-home end-of-life appointments, that's what upsets me the most is I see them waddling around on their tile floor or, all these other symptoms that I'm like, oh, we could help. So But the more things like we do in, with this video and the messaging that we put out there, hopefully more people won't be nervous about going to their veterinarian, and know that we can help them. So can you just say, like, what is cognitive dysfunction?
Yeah. So cognitive dysfunction is, as far as we know, a lot like Alzheimer's. It's probably likely that dogs also get like vascular dementia and the other types of dementia, but we don't know that. But they happen to be a really good study subject, let's say, for Alzheimer's because the changes in the brain are very sensitive. What you'll look for are 5 categories of signs: disorientation, changes in interactions, changes in sleep-wake cycle, changes in house training, and changes in anxiety or aggression. So if you're seeing those changes, you want to get to your vet, but I'm going to ask you to make it easy on your vet, right? Why not make it easy on somebody?
Yeah.
Go and find the Purina CDS scale. You can find it on my website. It might, I don't know if it's on Lap of Love, but you could search it.
We're going to put it in the chat. I've got a wonderful Deanna, my girl, is watching, so she catches on and does this. And we'll put also your website towards the end too.
Good.
It's a little chart, right?
It's a little chart and it has a score. And doctors, you guys, doctors are programmed to read tests. We love numbers. So if you bring us, right, we are robots, do a test. So if you bring us this scale and it has at the bottom 20, that means we know automatically your dog's moderately affected. You should be looking for this. You should be bringing it to your vet and handing it to your veterinarian anywhere past age 8, because dogs 8 to forever, 16, 17, 18, can show these signs. So we want to be keeping track from 8 years old on paper with numbers, these clinical signs in your dog.
Yeah, because the statistics are horribly alarming, where it's like at least 50% of dogs after a certain age. It's a lot of dogs. Let's just say that. It's
a lot. If your dog is 11 plus, your dog has some sort of cognitive decline. There's no doubt. Yeah.
No doubt. My girl Sam, so she's Anatolian Shepherd, so she's a big dog.
Oh, yeah.
And she's over 14 now, and she's got lymphoma in her spine, so her mobility is really bad, and that's why she's incontinent. Really is that's not working well. But it was the day after Thanksgiving. She just started at 7 o'clock at night. She just stares at me and barks and barks and barks, and it's just so frustrating. But we'll get through it. So and I'm also watching our thread, so that way if any good questions come in, I'll certainly pop them in, and please say hi from wherever you are. So the scale, we're going to post the link to that scale. Is it more than one of those categories, or even if it's just one of those categories, you should talk to your veterinarian?
If it's even one of those categories, because the problem that we have with cognitive dysfunction is that the signs are nonspecific. So the problem is, you tell your primary care vet, my dog's staring at walls. The first thing she's going to do is physical exam, neuro exam, run blood work, including a resting cortisol. So she's got to make sure that she's not diagnosing CDS without actually ruling out a lot else, right?
Yeah.
Okay.
Right. No, it's so important. Okay, so why do some people, do you think, hesitate to bring their pets in when they see these problems? Like, they're just so scared to bring their pet in. Do you have any thoughts on that?
I actually do, if I can make. So my heart dog, the dog who is on my logo, the Rottweiler on my logo, I actually submitted the picture and said to the artist, this is my cat, this is my dog, put them on my logo. So she was my heart dog, and she would cough sometimes. And I was, as a doctor, I'm ashamed, really. And I almost can't talk about her without crying, but I didn't bring her in. I knew I should have brought her in. But she was a Rottweiler. She was 9. She was going to have cancer, and she did eventually have cancer. And the day I brought her in was the day she wouldn't eat a strawberry. And I was like, that's it, baby. Ain't no way you're not eating a strawberry. So I did bring her in. We found osteosarcoma, the oncologist, in her shoulder. And I had about 8 days. So I know that feeling. It is scary because you don't want to know. But now I will tell you, I was able to alter my own behavior. So I'm going to give this gift to you. I do what I call a helicopter mom check once a year. My dog is 9 and some months. His birthday is November. He'll be 10 this year. Once a year, we go to see the internist. I have chest rads. I have an abdominal ultrasound. I run a gigantic panel of blood work. and a urinalysis. I sedate him so he sleeps through the whole procedure, and I x-ray because he's a lab and he has orthopedic. He will have orthopedic. I go ahead and do the joints. Is that a cheap endeavor? No, but I got pet insurance the day I got him to make sure I could afford it. Even as a vet, it's expensive, right, to do. So I got my pet insurance and I do it, but it's peace of mind. So that way I will catch the smallest tumor. I force myself to go before it's a problem, right? So I catch the smallest thing, I fix it, and I feel better about his quality of life.
I love that.
Helicopter mom checkup.
I'm like you. I do the year. So Dr. Beth Lechner is an internist down here in South Florida.
I love her. Yeah, I love her. Love her. Yeah.
We are both, for those watching, we are both in South Florida, and so we know a lot of the same people locally. And so I myself bring my own dog to get a full checkup, and it was last year when Sam was starting to. I was like, why is her leg shaking like that? And I went through the whole degenerative myelopathy and all these things. And unfortunately, what we found. But this cognitive dysfunction I have had, besides my cat who had it, I've gone through every disease, Cushing's 3 times, diabetes, laryngeal paralysis, cancer, like so many. This is really hard. And it is stressing my caregiver bones like nothing else. And
because you feel helpless, don't you? Don't you feel helpless? Yeah.
Look, I'm really trying everything, right? And we'll talk about some of those things. And that's like for mobility, I've got it. I got the help and harness. My whole house is covered. I've got it. I know when it, but this is like she's inconsolable, and that to me is suffering in some ways. And it's suffering for me because I want to. It's like I want her to quiet down. So I see a lot of stuff going on. So when I really want, the problem with lack of love is that we see them too late. By the time I see them in hospice or right before we euthanize, they're like, what's the magic pill? There ain't no magic pill. And there are some things, but man, we got to start early, right? It's sort of like if I said, now, what am I going to do with these little wrinkles, right? Like I should have been drinking more water and doing stuff.
Yeah. Botox, just forget the water. Just get the Botox, really.
Right, but there's things
you can tell we're in South Florida, right?
I know, we're very in South Florida here, everybody. So, okay, when should we start? And we'll talk about what to start with, but when should we start? Like after 8, right? We should be looking at these scales and checking them out.
Yeah, 8, you're going to write it down on paper so you have numbers because we forget stuff, and you're going to start supplementing for brain health. And you have some of those supplements right in front of you. You have Senalife.
I do. I was going to say, let's start with this one because Senalife,
That's a good one.
It's a good one. Now, I watched a lecture of yours recently, and you said something that I also hate about this drug. It is the size of this pill.
Prenatal vitamin. Yeah.
It's well, I'm making it look big because I'm putting it in here.
No, that's actual size. Yeah.
Like, sure. So it's really big, and Sam doesn't love it, so I have to, hide it and whatnot. So tell me about this. Like, is it a nutraceutical? Is it,
It's a nutraceutical, right? It's got a phospholipid membrane stabilizer. It's got a cofactor for GABA. GABA is a neurotransmitter that helps you calm down. You got it all over in your brain. Your dog does. Everybody's got it, okay? So it helps you stay calm. It's also got in it ginkgo biloba. We all know what that is. You take that for memory, right? It's got resveratrol in it. Which is what you've heard about that comes from grapes. Like they tell you drink wine, right? But you'd have to drink a gallon of wine. So this is really concentrated, or you could drink a gallon of wine, but you can't give it to your dog. So then omega-3s, vitamin E, this is think of it as a multivitamin for the brain. There is one actual study looking at this as well, and it can work in as little as 7 days, but really you got to give any nutraceutical minimum 30 days to reach that maximum effect.
Okay, perfect. And we could start, it's very benign, let's say, right? We could start this way early.
Yeah.
I think so many people worry about drugs. So the other day I was on a Facebook group. I won't mention the group name here because some might be on here. And the person wrote that their dog has a UTI and they just don't want their vet to give them more drugs. So what do you all recommend? And I'm like, so you don't want more drugs yet. You're asking everybody what to recommend, which is stuff. And, and cranberries just ain't going to fix your UTI.
No.
So many people get nervous about things, yet they want the CBDs and they want all these other stuff. So for those of nervous Nellies out there, very safe, the Senalife.
Yeah, very safe. And if you have a little dog, the thing is that you really should be buying the regular size, but I think sometimes companies forget that at least in our neck of the woods, we have little dogs.
We do.
So sometimes I will just cut that and squeeze it onto the food. And if I don't get all of it and my patient's like 6 pounds, it doesn't matter. For the big dogs, you really need to get gel cap in the dog.
Perfect. So now there's another drug that is very, common, and it is the old
Anapril.
Anapril. So tell me about this one. This is different, not just a nutraceutical.
Right. So that's a real drug, and it's been tested in dogs to see if it helps with cognitive dysfunction, and it does help lessen the signs: overnight wakening and urination in the house and cognitive decline. This is I had a hard time the other day in my lecture, and I was talking to vets kind of describing it. It's a great medication. It's fantastic. It's not a benign medication. Don't interpret that as this will kill your dog. No, or this will affect the liver. What I mean is older dogs are on a lot of different stuff. And so this medication limits the stuff the other dog can be on. So it doesn't mix, it doesn't play well with others on the playground. So I love this medication, but your vet has to really be aware of the possible interactions when he or she is prescribing. And if you're like most of us and your dog's older, your dog has a team. They might have a rehab specialist, and they might have an end-of-life person, a doctor, and a internist. You got to be telling people that your dog is on this medication, so that medications aren't prescribed that would cause serious side effects.
So good. Yeah. So do not just store this from one pet and give it to another because you need to have the same. People do it all the time, Dr. Lisa. It drives me crazy. Okay, now, so what about, I feel like I'm, testing here. Melatonin. We see this a lot.
Yes. Yeah, melatonin, it's pretty benign. I will say some people report that they have agitation on melatonin, or they have really scary dreams, nightmares. So just watch your dog the first couple times you give it. But melatonin can help your dog sleep and can have some anti-anxiety effects. So absolutely, you can give melatonin. Think of it as a sleep aid. So you're going to give it maybe an hour before your dog needs to go to bed. If your dog is waking up at 2 a.m., let's say, and you go to bed at 11, you're going to give it at 11 because you don't need to give it an hour before lights go out. We need to get it in your dog an hour before he or she would wake up. So that's how you're going to space it. Okay.
So what about some other prescription meds, like anti-anxiety stuff?
Yeah, well, there's one more supplement if you want to talk about one more, and that's Demi, which is marketed for the liver, right? Marketed for the liver. But what's in that is called SAMe. And SAMe is a really bold antioxidant for your brain. So it helps to take those free radicals that are damaging the neurons in your dog's brain and just shut them down. So that's available from your vet, Demi, and there's one, I think that's called Advanced, that has a bit more of the active ingredient in it. So I always try to move people into that one.
I forgot to bring that. Sam is on it, and she was on it because she's on prednisone for her cancer, and so her liver enzymes are high, and so I was gathering her stuff. Now, I have two other things, because I'm going to ask you about trazodone and things like that. But you know what? We got to talk about the elephant in the room. What about CBD?
What about, and that's the company that we are doing a study for. Yeah.
That's the only company I'll recommend for this right now is Elevec. There's such good stuff.
Exactly. So here's the bottom line. We don't know. That's the answer. End of story. So we don't have enough information on CBD in general to know really what dose to give your dog. There are studies going on, absolutely, not at my practice, but at universities primarily looking at arthritis and seizures. There's a ton of promise. For anxiety, we have no solid studies showing that anxiety, fear, or stress are relieved by CBD. However, as many of you know, if you watch us on Facebook or you're local, is that we are working with Elevec to test one of their products for noise phobia. So we do need 2 more dogs. We need little dogs to finish out our group, tiny dogs. So you can contact our office or go on our website and contact us. But we will hopefully get information from that study that will give you dosing. And I'll tell you this, if you're going to do, and this sounds very self-serving, I don't know how to say any other way, but I guess that Dr. Mary said it first. The reason we trust Elevec is because they're the only ones who have truly invested in research time and time again. Not one little study, but again and again, they're going to put their money up because research costs money. and they're going to investigate it. They did work at Cornell. They're doing work up with another veterinary behaviorist. And I like that because I don't want to hurt my patients. Probably one of the reasons that you're seeing failures if you've used CBD and there was a failure is because it's not the right dose, because we don't know the dose. That product isn't high quality because ain't nobody looking at it. Nobody knows, right? Or the product that's in that product, maybe that doesn't work at all. Maybe it's not even the right ingredient. So we need good, solid information. And as soon as that is published, you will find it first on my Facebook page, really, because I want to answer your questions. I really do.
No, you're amazing. So please don't go to the farmer's market and just get it at like some tent, a pop-up tent where it's some MLM system that like you're selling it. So that's what Elevate is what I use for my girl Sam. Somebody wrote, and Dr. Sheila, thank you for reminding me, make sure your melatonin does not have xylitol in it because you can over the counter sometimes. So thank you, Sheila, for reminding me to say that.
Yes, and not extended release. No.
Right.
Dogs are not meant to take extended release because the gut transit time is different. So no extended release on anything you ever give your dog. So even if like your dog's on a medication and you get it from the pharmacy and they give you extended release by accident, just don't do that.
So what about composure?
Yeah. So composure, and I try to get people to get Composure Pro because it has more of the L-theanine. Yeah, it has more of the L-theanine. L-theanine is really well researched, and in human beings and in dogs and cats, it can lower anxiety and stress by blocking glutamate. And glutamate is the gas on your neurochemical system. So when you block it and it doesn't bind, then you have this kind of overage of GABA and you calm down and you're less stressed. And it facilitates the binding of that neurotransmitter that's necessary for happiness, which is serotonin. So we really want to increase that GABA and serotonin in the body. L-theanine comes in all kinds of different products. What you want to make sure is you want to flip the package over and it should say sundowners as the brand of L-theanine in it. Now, Composure Pro has been looked at, and what is interesting about that, here's the interesting thing, is that that's the only supplement with L-theanine in it that has been shown to work within an hour. The other ones, which I love, I use the heck out of Anxetane, Soliquin, like I use them all the time. The Composure Pro actually has a study in 10 dogs showing that within an hour, some signs of anxiety were relieved. So that's something you can pop in your dog's mouth when needed. Mm-hmm.
So I've grilled you on a lot of drug stuff, but what about environment and enrichment? Because I think that's just as important.
It not only do we think it, but what I always tell my clients, because they'll say to me, is this your opinion? I'm like, no, this is science. So the science shows us, and that's why it's my opinion, because I love science. So the science shows us that dogs who are enriched and receive these other supplements, my hands are in the picture, these other supplements, will have less cognitive decline, and the signs of CDS are more likely to be reversed when compared to supplements alone. So what is enrichment? It could be exercise. When you exercise, and I'm not trying to bore anyone, I do love science, you increase BDNF, which affects the neurons in the brain. It makes them grow up. It makes them get bigger. It makes them get stronger. So we want to exercise. What is exercise for an old dog? Walk to the mailbox. Take a ride somewhere in the car. Just move your body a little bit. You can enrich with food toys, nosework games. You can teach one trick to your dog every month. It can be so simple. You can go in the backyard and sit there and have your coffee so your dog can lie in the sun. It is a change of what he smells, what he sees, what he hears. You could change the music in the house. Anything, right? Would enrich him. Yes.
I love it. I bring Sam for some car rides. She just sits in the back looking out, It helps me too, Dr. Lisa. Like, I just feel like I'm doing something. And another thing I use with Sam is sound machines. So I have one that's got, she likes Babbling Brook right now. So
nice.
And I know I'm waking up, like, where's the leak? Because I hear like these water sounds. So I don't know if it's helping really or not. But you mentioned something in a talk the other day that was interesting about looking for the signs. And I know we see a lot of circling and pacing and panting and things like that. But the tail not being like a happy tail, basically. And I thought that was
Yeah.
interesting. I thought to look at that because Sam's tail is paralyzed. So it's anyway because of her disease. I know.
Yeah.
So
It's
what
that,
do you think about
it's that
that? Like you're
disconnection.
mentioning that.
Yeah, it's that disconnection with joy. The body is just apathetic and the tail is flopping down. And it's not tucked. It's not like the dog's really scared. They're just not connected with the joy of being in your house and being with you. And that's, to me, so sad to have a joyless. Your old age should be when you're partying, you know, when you're happy as can be, right? Yeah, not depressed.
I agree.
Yeah.
I forgot about something so big. It's food.
Yeah.
There's a lot to this disease, so I feel like I'm all over the place. So what do you think about some of the food diets out there? Because Sam is on one.
Yeah, there's two. There's Neuro Care. Well, there's actually sort of three because there's Bright Minds. There's Neuro Care, which is going to be Purina. Bright Minds, which is the kind of box store facing version of Neuro Care, is not identical. That is in like wherever you'd go, PetSmart or Petco, wherever you buy your stuff, Pet Supermarket or online. And then there's BD, which is from Hills. And so I hear people, I know that you're attached to your dog food. Like, I get it. At the end of the day, CDS is a disease. If your dog had kidney disease and your vet said this kidney diet will prolong your dog's life, I don't think you'd argue. If your dog has CDS and these diets can prolong your dog's life, what are you waiting for? Right? Let the bias go out the window and give the diet that we know from scientific studies in older dogs improves their quality of life. And at the end of the day, because we have the ability to end suffering in our animals, if we extend quality of life, we extend life. Because we, the human beings, the parents, make the decision about when it's time. So why not extend quality of life and thus extend quantity of life? And the foods can help do that.
Totally. I agree. Dawn uses the Licky Mat, which I use also. I love
it. I love the Licky Mat. Although I have a lab and he would licky and consume the mat. So he has to have supervision because the Licky Mat is not hard. And, you know, labs, they just eat things.
Yeah, I know. My sister just this morning had to teach her how to make her dog vomit because he ate some chocolate. And she was a lab. But the Licky Mat is good.
They're so funny.
Oh, I love. So the Licky Mat is great. What else does she? I have a snuffle mat for her too. So it's like, you know, a little towel product, and not really. It's like little pieces of felt or fabric or whatever, and she just hunts for her dry food. Problem with her is because her mobility is so bad, she can't stand for very long to hunt around. So I do little mini versions of it.
Yeah, that's what you have to do. And there are so many food toys online. There's the original Calm toy, right? There's all kinds of food toys where your dog slides something with her nose or pushes something or pulls something. And they can be it's like the easiest one I have in the clinic is it's 3 stars stacked on top, right? And the stars spin. So all the dog has to do is really push with her nose to spin 1 star. And then there's a pocket where the treats are. So you can go as easy as you want. The idea is not to make this hard on your older dog. It's to just occupy their time and stimulate their brain. Yeah.
I love it. Kara says, my older dog is starting eating paper. Any advice?
Yeah. So you know what? With mine here, I'm going to be Dr. Buzzkill. Nice to meet you. So the thing is, when there's a change in your dog's eating habits and your dog is older, that is a trip to the veterinarian, because I just in this past 4 months, had a patient who presented to me with cognitive dysfunction. One of the signs was change in eating habits. The dog was more ravenous, was like dumpster diving when he never did that. And he's 12. Like, why would he do that now? It doesn't make sense. That triggered me to do lab work. That triggered me to send that lab work, which had some abnormalities, back to the primary care. So turns out that this particular dog, so that triggered the primary care to do a rectal exam, which you should do on older dogs. No, you know what we found. You know what Donna found. Yes, cancer.
No.
Yes, adenocarcinoma. Took it out. Dogs did well with surgery. He's going strong. So if something is wrong, it's wrong. Yeah. If your dog did it his whole life, then okay, let's just shut the garbage and close the bathroom doors. If this is new, you have to hunt it down. Because when you hunt it down and you find it early, you're like my little precious golden retriever patient I just described to you, who's 12 is going to live to be 17 because his mom hunted it down early. She didn't ignore it. And the vet didn't ignore it, right? The primary care was on it too. So that's a story of success, right?
I know. You know, it's amazing the little presentations in behavior that change with so many diseases. And when I brought, not it's a little off topic, but when I brought my dog Norin to you for what I said aggression, because he's just crazy, you know, and so you taught me to use my words better. But I mean, the first thing was like, let's make sure he doesn't have anything else going on that's causing these issues, and he didn't.
Yeah. He didn't. He's just, you know, who he is.
He's just a little sassy pants.
Sassy pants. Diagnosis, sassy pants.
And Sam is not thrilled with him. So what about pheromones? And I would put this on Sam.
Yeah, you should. Yeah. Comes as the collar, a spray, a diffuser. Pheromones are widely investigated, probably the most researched behavior product of anything else out there. So will it help every dog 100%? No, but you're looking for percentages. And I think you can reasonably expect about 25 to 50% change in your dog. So for something that is benign, won't cause side effects, even if you get a 20 and cheap, even if you get a 25% change, it's worth doing in my eyes. Right. And so it's a pheromone analog. So it causes the dog, we think, to remember when they were first exposed to that pheromone, which was when they were nursing from the mom as little bitty babies. So yeah, use it for sure. Yeah.
That's interesting. It's like a good smell, like a Play-Doh smell for us. Like, yes, good times.
Cookies.
I like, okay, that's even better. What about rescue remedy?
Yeah, so rescue remedy is I'm thinking specifically of Bach flower essences. So that is something that really, if you look at the literature, has been shown to not work very well. I certainly have clients who come in and say they saw a little effect. You're going to use that if you need your dog to be a little sleepy, a little calmer. But again, with anything like that, OTC, you're not expecting some major change. You're accepting that it's going to be a very tiny change.
Yeah. So I was just thinking, a lot of people, and you mentioned it in your talk last night, what I worry about is if somebody just has some ace-promazine laying around their house, and they just want, because I see a lot of, you know, I like to say I need a word, and maybe there's a word out there. It's not polypharmacy, because polypharmacy is within yourself, but like my other dog had it, so let me give it to this one, and that is so dangerous. But ace-promazine in itself.
Yeah, so there's a couple things, because I know there's people watching who say to themselves, ace-promazine is a horrible medication. My dog was too sedated on it. So I want to say it's not a horrible medication. It's misused in veterinary medicine. It's a sedative. And so when you think about that, you think, I want my dog to sleep. I'm in. This is the drug that I want to use. But the problem is it makes your dog ataxic, sort of drunk and wobbly. And so, you know, we don't want that for your old dog who's already arthritic and can't navigate through your house without pain. It also can lower the blood pressure, which again, I don't want in an older dog on a bunch of meds that might have heart disease or kidney disease or whatever. So it's not going to be my first choice. Does that mean I never use it? No, but that means it's used really carefully at low doses along with other medications.
So the two that I always think of a lot are gabapentin and trazodone. And I usually start with gabapentin. And what are your thoughts on that?
So gabapentin is proven to relieve anxiety, to relieve pain. It's also, can be for dogs with seizures, but we really don't use it that way. And so it can be a way to help your dog sleep and relieve anxiety without causing that full-blown zonked moment, right? And then trazodone is an antidepressant technically, but it's really a sleep aid. Somebody here has taken it. It's called Deseril. It's a human medication. Mm-hmm. And so just like it would make you sleepy, it would make your dog sleepy too. So I often start with gabapentin first because I usually do have some level of anxiety, and I also want the dog to get some pain relief as well. And then I might layer trazodone on top of it. What I want you guys to hear is that if your dog isn't sleeping at night and it's due to CDS, it's going to take a little bit of time. It's not going to be the first medication your vet gives you at the first dose. I know you're sleep deprived and that sucks, but you got to give your vet at least a couple weeks, at least, to figure out what's going to work for your dog.
No, really true. And also be careful of the other stuff. Like you were saying with Ace, with Sam, I couldn't really with her gabapentin, she was a little too ataxic, so wobbly. And because she's got that already because of her spinal cancer, I'm like, oh girl, we got enough to worry about. So this is it.
Right.
Now, I know a lot of people, especially listening at Lap of Love, have to think about end of life and saying goodbye. And I think sometimes it's really hard on us emotionally to euthanize a pet because of cognitive dysfunction. And especially if I've been to homes both directions where I walk in and this is the issues, and they're like, man, we wish we could have this in human medicine, because we have a family member that's going through it. And my uncle had early onset Alzheimer's, and he didn't know, it was totally gone within like 3 years. Or they'll say, how dare you do this? We don't do this to grandma, right? Like I've been.
Yeah.
Do you have any words of wisdom for those that are struggling with this? And it's, it is, I always say mental illness is still an illness. Like this is anxiety is not good. Like, and I just wouldn't want this for myself. It's tough, but people don't think of this as a sickness as much as like cancer. So,
but it is a physical illness of the brain. There are changes in the brain. There are also neurochemical changes of the brain. That is how we define illness, physical neurochemical hormonal changes. That's what's happening. But bigger than that, I'm not the expert. I'm a pet owner, right? I'm not the expert in when to do this. I can tell you what I tell my people, those are my clients, and what I do for my own pets. Everything that I do for my pets and my patients is guided by the 5 freedoms, okay? Freedom to engage in species typical behavior. Go for a walk, lie in the sun, play with a toy. Can your dog do that? Number 2, freedom from fear, anxiety, and distress. We all are trying to seek that in these crazy times of COVID. Our dogs deserve that. Freedom from pain and discomfort. Can your dog navigate where you live? Free from environmental discomfort. Is your house really slick, highly shiny marble floors? You need to get some carpet runners if your dog is painful, okay? Really? And then freedom from malnutrition, from hunger, and from thirst. First, I look at the 5 freedoms. The second criteria I use very quickly for my own pets is now I've had enough pets that I know them well. And in the beginning, I set a criteria. What is your spirit? Who are you? Who are you really? What brings you joy? And when I see that the joy is not there, that is when I can logically say, I got to really be thinking about this. So when Peanut, my Rottweiler, my rescue Rottweiler, 12 and a half, could beat cancer twice, had a wicked kidney infection, she was strong. She stopped chasing her ball on the very first day. That ball lived in her mouth. She never put it down. The day that she wouldn't chase it, I called my husband and said, you need to come home. This is happening today. He's like, does it have to be today? I said, her spirit, her joy, it's not here anymore. She's not here. And that's not okay for me because she gave so much. How do I repay her? I alleviate suffering, right? So that's what I do. You could do something different and that's okay too.
That's a good point. Like we are all so different in this, right? With Sam, I have some people that are like, you did radiation, you did chemo, you did that. Like I would never do that for a 14-year-old dog. Well, okay. And that's okay, right? So
that's okay. Yeah.
I usually say, like with bucket lists, I always say, these are the things I want to do for Sam before she passes. But I also think of a joy list. And that's helpful for me to define when that time is. And now Sam, though, she's just she's always been very apathetic, just sitting around. She's so it's hard because I'm like, you're not really doing much, but there was little things like coming to me for just a head rub, and that was her thing, and she's not doing that as much anymore. So I know that I always say I'm circling heaven's airport. Some days we begin and sometimes we take off again because it's not ready yet. And it's a little bit on me. So I'd say that because there's a lot of people that are like that, and you can be on Denial Island. I've been the queen of Denial Island myself.
Denial Island. Oh my God, that's a good one.
Right? So we've all been there. So Inga wrote a great sundowners.
Yeah, so what CDS really does look like sundowners. We don't know that dogs can actually get that, but it really does look that way because it gets dark and we see that the patient starts pacing, panting, staring at walls. We do use melatonin for those dogs. It doesn't seem to be the fix that we were hoping it would be. So we treat them in the same way we treat any CDS dog. Same way.
Okay. So somebody asked me to do the 5 freedoms, so we're gonna post that in there. I know where to find that. It's a great 5 freedoms. Yeah. Deanna, if you could find it, post it in there for me, because
I need a Deanna. How do I find one of her? Can I find one?
Info, because she's great. She makes me look good. She also puts these fun things on my screen, which I always forget about to put on there. So that's me. And that's you.
There you are. So professional.
I'm so professional, but I forget about them. Now, but I want to give you mega shout outs. So tell me about, there are a few things that I think I want to touch on. So you're down here in South Florida, but you've got a lot of great stuff nationally too. Besides an awesome book. Let me do product placement.
So our 2 big things that I'm interested in making sure that we get out to people is in 2021 is Top Vets Talk Pets, which is a group of 14, 13, 15 of us, all kinds of vets, all kinds of different kinds of vets. There's dermatologists and neurologists, and Justine Lee, who owns That Girl on the Run, is on. We've got emergency critical care specialists. We got some famous people like Evan. He's very famous veterinarian. I don't know, but he's sexiest veterinarian alive. I feel horrible. I don't know him, but he's there. So we're trying to make sure that people have on YouTube a one-stop shop for good information in small bits that helps them manage their pets better and know what's going on with their pets. So you can go to Top Vets Talk Pets, and then Dog Nerds, therealdognerds.com is where you can. Yeah, therealdognerds.com is our online learning platform for pet parents. And that has 2 programs, reactivity and noise phobia. And there's tons of videos and tons of handouts. And it really hits, these people that have pets who are suffering from noise phobia or reactivity are suffering themselves. And the idea is for these programs to alleviate that suffering in the pet and the suffering of the pet parents, and give them clear tools that they can work through with support so that they can help their pet and they can feel better themselves.
Yeah. Listen, Bill Harris says Evan Anton's from Arizona. So Bill knows.
Darn it, Bill. Okay, Evan, I'm so sorry. I forgot your last name. It's Evan Anton. He's one of us. Marty Becker. There's so many more. Marta Sanchez. You know Marta Sanchez, who's down here. She's one of, a lot of people. Yeah.
A lot of vets, or a lot of our listeners have wonderful primary care veterinarians, but sometimes they need help from people like you. So is there a way for the primary doctor to get advice from you for some of these people that are watching? They can't talk to you directly. Only me and Deanna get that privilege, but
yes. So your vet can do a telehealth consult, right? It's vet to vet. So I can't talk to you, but your vet submits a consult, and then I can give them a plan for your pet. And then if you have a problem with whatever it is, say there are more challenges, you go back to your vet comes back to me. So definitely we can do that. So if you're not in a place with a veterinary behaviorist, you can still get expert care. It just has to go through your vet. And the reason that we do that is it's the law. I can't give you advice about your pet because I haven't examined your pet. And in Florida, you have to physically see the pet in order to do that. Yeah.
I mean, listen, I actually, everybody listening, I actually see Dr. Lisa Radosta for my asthma. So I'm not just the host here. I'm also the queen of Denial Island and a lot of problem children. So for somebody's vet to get a hold of you, is it the floridavetbehavior.com and just kind of find their way?
Yeah, if they go to flvetbehavior.com, they just need to click on the veterinarians tab and it brings them right to where they have to go.
And Deanna did put Dog Nerds out there for in the chat for you guys. So Dr. Radosta, did I forget? I was so excited to have you on here that I think I just verbal diarrhea and everything and was all excited to show you all my products to try. So is there anything I forgot?
You didn't forget it. I just feel like it's important because as I was watching the chat, one person basically said, I brought my old dog to my vet. And the answer I got was that my dog was old. So I just want to ask you as people out there, pet parents, to believe that if you think something's wrong with your pet, something's wrong. That's what I tell the doctors that work in my service. If the pet parent thinks something's wrong, something is wrong. You don't know what it is. That's your problem. That's not the dog's problem or the pet parent's problem. So if you feel like you need to advocate for your pet and come back and say, I'm requesting these things, or I know what you're saying. I hear you, Dr. Smith. I still would like you to run that blood work. I hear you, Dr. Smith. I still would like to do this. I hear you, Dr. Smith. Could you please refer me to someone else that could do these things? Because not every primary care practitioner wants to be involved in this. Like, I went to vet school, but if I see a red eye, I go ophthalmologist. Like, your eye's red, ophthalmologist. So that's okay. They don't have to be the master of all things. You can ask for that referral, advocate for your pet. You know in your heart that your pet's sick. It means your pet's sick. You're right.
You're right. And old age, I always say is it's not a disease, but man, it brings some problems. And don't we know it? And right, all of us vets do not know everything. And to find a humble one that's open to listening and reaching out to you, Dr. Lisa, and to some other experts is wonderful. I remember when I was in general practice, I would the 3 O's: ophtho, onco, and ortho.
I know. Eyeballs are so gooey. I'm like, ophthalmologist.
I'll take an old skinny cat or a wobbly dog any day now. So is there any last thing that you'd like to tell all? This is one of our biggest live watches. I knew it would be.
What? Yay!
Oh, Tara's up in Canada. Thank you, everybody. It's hard being a host and reading these things and then listening and learning. So
it is. It is hard because you have to multitask, and as you get older, your neurons, they're not as healthy, and you can't multitask. Take some Senilite.
I love it. But one little thing I do with Sam, because she's got her mobility issues, she goes 3 times a week to rehab, where they're doing a wonderful job. But I tell you, it's her brain too that's helped there. So they're doing little exercises, and she gets in the water tub, and it has been very helpful for me to have her also out of the house 3 days a week because I can get work done. Yeah. And that's why I always say, it's not just about the monetary budget. It's about, your time budget and your emotional budget when these things. And there are, the weekends are hard because it's just me and her, and it's like going to be a big one. But
you're a caregiver. You're a caregiver, just like the caregiver, in any situation. And you're right. Rehab is really important. And I was at my friend's gym the other day, and I saw his dog, and he said, "What else can I do for her?" And I said, "Is she going to rehab?" He's like, "What?" It's like, "That's a thing." I'm like, "That is way big a thing." Yes. Go to rehab, get those muscles stronger for sure.
Yeah. Get them stronger. She gets acupuncture. There's some great acupuncture points also for relaxing and things like that. So Sam's got it all. She's my little guinea pig, poor little baby. But I want to thank everybody for listening. Dr. Radosta, I cannot thank you enough. And I miss seeing your face in person. And it'll be nice to get back on the road speaking again. And I love seeing where everybody is from. A couple of Canadas. We had a Brazil, my friend in Mexico. And so I hope you realize, Dr. Radosta, what a great service that you provide to not only families, but to us veterinarians that need help from people like you. And
thank you.
And I really appreciate it.
It's really, I love it. I told my friend the other day, I'm going to drop dead at 100 years old in the exam room. Like, I still love it. And I'm grateful for every person who signs on to this and does something for their older dog. Like, that's the whole point, really. So thank you for bringing this to everybody's attention.
Oh, no, I love it. And I follow you on Facebook and Instagram too. So it's the floor. Let me put look at, I got to do my job. I got to put the little thing back up there. So it's the same, there it is. FL Vet Behavior is your
that's the Instagram, and I think it's Florida Veterinary Behavior Service on Facebook. And we did, if you do go to those, go back, because we ended out January, the last 10 days, with a tip a day for cats and dogs who are geriatric. So you'll get a bunch of tips.
I love it. So I might have to steal you back for a kitty cat discussion, because you can't forget those little guys too. But everybody, thank you for coming, and don't forget to love up on your little skinny cats, wobbly dogs, and all the gray muzzles out there. So thank you again, everybody. Thank you, Dr.
Bye. Thank you.
Bye.